My name is Tyler Moore, and I'm a trauma survivor thanks to Grand Strand Medical Center.
My name is Shane, and I am a respiratory therapist here at Grand Strand. I was not feeling well that morning, and they told me to go ahead and take the rest of the afternoon off. My wife, Lynn, is also an EMS provider. I stopped by the rescue building to let her know that I was not feeling well.
Tyler called me, and he said, "Mama, do you have some money?" And I said, "Well, of course I do. If you want some, come down here and get it." He was not working that day, and he said, "All right, I'll be down there in just a little bit."
We got a 911 call for a very serious wreck. She asked me to go with her. When we got approximately a half mile from the scene, the 911 center called back and said, "Don't go, you're responding to your kid."
Our dispatcher called me, and when she said Lynn, my heart hit the floorboard. And she said, "You're responding to a wreck." She said, "It's your baby." She said, "And it's bad."
When I first drove up, I seen my kid laying outside with one of our other members of the rescue department. Lynn initially ran over, laid down beside of him, and I recognized that he had major problems. At that time, I activated the local 911 center to get a helicopter to respond to us. And it was my goal, my hopes, that Tyler could be sent to Grand Strand.
Shannon called for a helicopter. Our local helicopter could not fly. It just so happened Grand Strand had a helicopter, and they were monitoring, could hear our channel, so they said they would respond. I knew that's where he needed to be at. They were a good 30 minutes away from flying to meet us, so Shannon told them that we would drive until we saw them.
I was driving the ambulance for him, and I had been notified that his airway was collapsing.
The helicopter, we could see them coming, so we pulled over. It happened to be at a church. And so Shannon jumped out, and through 4 cones, they just went in opposite directions, and we waited. They pulled him off and put him in the helicopter, and we got back in the ambulance and followed.
When Tyler arrived, his injuries severity score was 54, and he had a 5% survivability based on his injuries and pre-hospital condition. His heart had stopped beating related to the loss of blood, so we had to give him massive transfusion protocols. We had emergently transfer him to the operating room where he had multiple surgeons present to operate on his internal injuries as well as his closed head injury. And that also included our interventional radiology, so we had simultaneous procedures going on at the same time.
The goal at this point was to stop the bleeding, identify the injuries that could potentially kill him at that point in time. And we did, and then we took him to the ICU and continued resuscitation to bring him back another day within 36, 48 hours, which we did, I think on 2 other occasions, until we actually were able to close the belly. And we did. And I remember having a conversation with Lynn up on the floor, and I'm pretty sure with Shannon a couple of times too, was we did everything we could. We got the bleeding under control. We actually closed the belly, so we're done from a surgical standpoint. The only concern that we had, remember the discussion pretty clearly, was I'm not sure what his brain's doing. Will he ever wake up? We just didn't know that.
I sat by his bed from Monday to Saturday. And Saturday morning, I took one of those little toothet things to go in his mouth and clean his mouth, and the only eye that he had that was functioning was his right eye, and it popped open. He woke up.
Tyler was here in the hospital for really only 18 days, which is pretty amazing considering his injuries. But he worked hard, and the team worked hard, and it was a great success to see him walk out of here.
Maybe 6 months later, we finally got into our new normal we talked about. We're ready to be a family. So now we have Marley, and our lives are busy. The days we're not working, we're spending time with her.
From the very minute that I walked in the door, they were so supportive, and they stood by my bed, and they brought me coffee, and they brought food, and they brought people just to talk to me, because I sat in that room and it's silent. The lady that cleaned the floors every morning, I will never forget her. She brought me a cup of coffee every morning. She says, "Baby, you sit here with your head on that bed, so I'm going to bring you coffee so you can be awake during the day." And every morning, she did that.
Grand Strand is now our choice of health care for everything that we need.
This is our hospital. This is where we choose to come, and these people are who we choose to help us.
Every minute we get a chance to come back and visit, we come back and visit Grand Strand just because there's so many people that we appreciate. There is no doubt that Grand Strand has credit to save my life.